Okay, now there is a lovely way that somebody examining a patient who has abdominal pain, there's a lovely way to sort out whether the abdominal pain is coming from superficial trigger points or it's coming from a very deep structure. So if I were, say the person said, oh, I've got terrible pain just here, and I press and they say, ow, that's really sore. Okay, so at this point, what I ask is this: would you do a little crunch for me? So just lift your, no, put your feet down. A crunch is you just lift your head and lift your shoulders up. Okay, so now what he's done is he's lifted head and shoulders up. The abdominal wall has tightened. As he does that, I push again. Okay, under these circumstances, thank you. Under these circumstances, what's happened is that the deep structures are now protected from my pressing by tight muscles. So if initially as I pressed, it was sore, it could have been muscle or deep organ. As he tightens his muscles, if I push then, if he says ouch, then in fact the pain is coming from the muscles themselves because they're splinting and I can't get to the organs. If I push and he says, oh, that's not sore at all, then I know it's a deep structure. So to treat these triggers, the first would be ischemic pressure, and you find the trigger. Remember that the muscles run this way, so the long fibers are running in this direction. You would run your finger across, feeling for tight bands. If you found a tight band, you run along that tight band. Once you're on it, you press and you follow ischemic pressure principles.